Hello everyone, this is Dr. Raghuteja, laser and laparoscopic surgeon, ONUS Robotic Hospitals. So in this video, we are going to discuss about fistula in ano. What is fistula in ano? How does this happen? What are the symptoms, signs, investigations, then management. So fistula in ano. The main pathophysiology behind fistula in ano is the untreated perianal abscess or incompletely treated perianal abscess. What happens with this? Whenever you have if someone is suffering with abscess, perianal abscess, if it is not properly drained out or not properly treated, then what happens? This abscess will turn out to be a fistula. So there are different types of fistulas you can see here. This is intersphincteric. If the fistula happens between two sphincters, there are two types of sphincter, external sphincter and internal sphincter. If the fistula occurs between two sphincters, then it is called as intersphincteric fistula. If the fistula happens above the sphincter, it is called as suprasphincteric fistula. Then in the same way, we have extrasphincteric and transsphincteric fistulas. So what are the symptoms and signs of this? So the most important symptom is patient will have mucus type of discharge from the opening. So for the fistula, there will be an opening here, we call it as external opening, and the inside opening we call it as internal opening. So there will be a connection between the internal and external opening, and there will be a tract like this. So this tract will connect the internal and external openings. Now the patient will have discharge in the perianal region. What type of discharge? It can be pus discharge, it can be serous discharge, it can be mucus discharge. So it will create a lot of discomfort to the patient. There will not be any pain, there will not be any blood discharge, but this type of mucus discharge will be creating lot of discomfort to the patient. So this is the most common and important symptom in the fistula in ano. If someone has a history of perianal abscess, untreated perianal abscess with this type of symptom like mucus discharge or serous discharge, we need to suspect fistula in ano. And how to investigate or diagnose fistula in ano is, one is clinical examination. Surgeon will examine the patient in the Sims position, the lateral position, then he will examine all these openings. If someone is having that external opening with this type of history like mucus discharge and all, surgeon will come to a diagnosis of fistula in ano. That will do 50% of diagnosis. Now how to confirm? Confirmation is through MRI fistulogram. So surgeon will advise MRI fistulogram. In the MRI, we can see the tract clearly, internal opening as well, external opening as well, and if there are like 2 to 3 tracts, that can also be detected in the MRI. Now, what is the procedure? How to treat this fistula? We have different types of procedures for this. One is laser fistulectomy. Second is video assisted fistula tract excision, that we call as VATS. So through the videoscopy, under guidance of videoscope, we will excise this tract. How? We will insert a probe into this tract. We will excise the tract through the help of videoscope, under vision, under guidance, and through the laser as well. We will burn out the tract. So there are different types of procedures. Even open procedures also will do. If the tract is larger, if the tract is longer, then we will apply a set-on. Set-on is a thread, so that the thread will excise the tissue. That is set-on exchange. That will be done for longer tracts. So this is about fistula in ano in brief. If someone is suffering with this type of problem, fistula in ano, perianal abscess, hemorrhoids, any type of perianal issues, I am Dr. Raghuteja, laser and laparoscopic surgeon, available at ONUS Robotic Hospital. Anytime you can reach me. Thank you.